I think that estrogen for women is the forgotten longevity drug. If it was invented now and came to market, it would be a multi-billion-dollar drug because of all the good things it does in terms of preventing osteoporosis and heart disease and dementia and urine infections and just everything. But because it came along a long time ago and because of some of the misunderstandings that came out in the early 2000s, women just don't know about it, and even doctors are still scared of it. There's a big lack of education about perimenopause and menopause and what that means and what these hormonal changes are. This is nothing to scoff at. About 10% of women during perimenopause become suicidal, and depression increases by 30 to 40%. People feel very anxious. Relationships break up, marriages split. This is a very tumultuous time, and it's certainly not all the hormones, but the hormones do play a big role. The women's longevity space is going to continue to explode, and I'm just so grateful that I get to be a part of this revolution.
Welcome to the Optimized Woman, where we explore the future of health and longevity and what it really means to live life on our own terms. I'm your host, Orshi McNaughton, and I talk with experts and innovators pushing the boundaries of what is possible today, so you can turn these insights into your own health transformation. Together, we are here to unleash the unstoppable force you're meant to be. So if you're ready to own it, start thriving again, and live the life you deserve, then let's get to it.
I was an emergency physician first, so I'm board certified in emergency medicine. So I was in the ER for the first 10 years of my career. And towards the end of that, I had my 3 kids within 2 years. So I had twins, and then I had another one 20 months later. And when my third baby was a week old, my husband moved out of state for a job. And so I was kind of like the lone caregiver to these kids, and I was still having to be in the ER at 4 in the morning, and working full time and all these things. And I started to, kind of unravel a little bit. High stress, not exercising, poor diet, all the things, like lack of sleep. And I just kind of realized one day as I was looking out at the patients in the ER, they were waiting to get seen, that if I didn't make some pretty serious life changes, that I was going to be one of those patients in 5 years with some kind of chronic, medical problem that could have been prevented. So that was kind of like the light bulb moment for me. Like I needed to make some changes. And for me, that meant leaving emergency medicine and learning a whole new field of medicine.
And that is such a common story. And as a mom, I could imagine how difficult that must be, navigating both being a professional, working in such a crazy industry. Like emergency care is like one of the highest stress jobs, right?
It is. Yeah. It's super high stress, but there's also like a lot of just difficult things. So, patients that you can't get out of the ER, and patients that keep coming back and you don't have resources for them, and you don't have enough time to really see patients. And so there's the emergency, but there's also just the system failures that the emergency department, absorbs all of that. And it's the place that everyone goes when nobody else can help them.
So when you first stepped into this longevity regenerative medicine space, it was still considered fringe, and in many ways it still is.
Yeah.
The mainstream healthcare system has its problems, and I'm sure you know all about that. What was it like to leave that traditional track of emergency medicine and then stake your career on something so new and unproven at the time?
Yeah, it was really hard. I mean, I had my identity was that I was an ER doctor. Like that's how I identified myself. And at the time, like you said, this wasn't really, hormones and prevention and functional medicine, and certainly stem cell medicine wasn't really being talked about that much. So when I started learning about these things, a lot of my like ER doctor friends, they would make fun of me, like laugh at me, say things that they didn't mean to be cruel, but like I kind of took them as cruel, like you're not a real doctor anymore. Like I don't know what you're doing. And there were years where I spent several years, not making any money because I was still learning how to be a business person. I had no idea how to have my own clinic. So I was definitely scared. It was kind of like jumping off a cliff and hoping that a parachute went off, but not really being sure it would.
You first came into the radar for me when you started getting involved with Docere clinics, doing the full body stem cell makeover. Can you talk about like how did that collaborative effort come together between you and Dr. Edelson? Can you walk us through like the partnership? How did it form? What got you involved? What were the protocols that you participated in? And you were, I'm assuming, part of creating that procedure.
Yeah. Well, at the time I was living in Portland. I had opened a small hormone clinic and I was seeing hormone patients, and I became interested in regenerative medicine. I first learned about PRP and using that, and then I started hearing about stem cells. This was back in like 2013-ish. So I ended up, I reached out, I emailed Dr. Adelson. He was one of the few people who was using stem cells for musculoskeletal pain, joint pain, back pain. I didn't know him. I had no connection to him, but I reached out to him and said, I'm going to be in Salt Lake City, which is where he is. I'm going to be in Salt Lake City in the next few months. I would love to, take you to coffee or like just see what it is you're doing because it sounds amazing. And he was so kind. He invited me immediately to come spend a day with him in the clinic and just watch his procedures and see what he was doing. And I was completely blown away. I was so fascinated by it because nobody else, very few doctors were doing this at the time. And so I just kind of kept showing up. I ended up moving to Utah, and then I just kind of kept showing up in the office over several months. I would just show up and watch procedures and kind of soak it all in. And eventually he was like, well, you're clearly not going anywhere. So why don't I take you under my wing and I'll teach you about regenerative medicine and you can use it for your procedures as well. So that's kind of how we started out. I do the sexual health, skin and scalp injections. He does the musculoskeletal injections. And so we ended up deciding to work together on these big cases where we put you to sleep. We inject all over your entire body in like an hour and a half, and we're able to really get everything done at one time. And it's a procedure that we developed, probably 8 or so years ago, the full body stem cell makeover, which we've been doing since that time.
Yeah, I mean, it's such a cutting edge. I don't know anybody like prior to that was doing something like that in the
Yeah.
space. And can you talk about how the combination of stem cells, exosomes, energy modalities, energy medicine, and light therapy and sound, like how did that all come together in the clinic?
So we just realized that, stem cells, they're obviously, when you give someone a stem cell therapy or an exosome therapy or a PRP, you're essentially just trying to communicate with their own cells to become more active and more youthful. Like we're just sending these messages right through these regenerative biologics. And we know that there are a lot of things in the environment, in our world, in medicine that we can use tools to improve how those stem cells work or improve that messaging. So, things like red light therapy, for instance, we know that, photobiomodulation increases the stem cell activity and how the signaling is sent. We know that things like low intensity shockwave therapy, which is the sound waves, can be helpful. I use that a lot for sexual health, but you can also use it for musculoskeletal health. And again, it's improving the signals, improving the increased blood flow signals, the reducing inflammation signals. So we started kind of stacking these different therapies. We started stacking a peptide that I had created that is a combination of BPC 157 and several other peptides to improve that. So essentially trying to say, how can we get the best result when we combine stem cells with other things to make them work even better?
Yeah. And can you just mention maybe patient transformations, any type of scientific breakthroughs that happened during that time? What convinced you that there was more to that niche? Was it just a niche experiment, or do you think now these procedures evolving more and more, are these procedures are still happening now, or what's going on with that? Are you still part of this, or
Yeah,
did you?
yeah, we still do them. We still do
Yeah.
full body stem cell procedures. It's not every day. I will do a few a month depending on the month. Sometimes they're busy, some are busier than others. But we have everyone's different, and certainly depends on. Some patients come in with a lot of problems. They've got multiple pain areas, joint pain, hip pain. They have erectile dysfunction, or they have a lot of issues. Some people really don't have a lot of issues. Probably about half of our patients are more like kind of a little bit younger, biohacker kind of people who are just hoping to optimize. So it really depends on the person, but we've certainly had, I would say, about 80% of patients when they come in with pain or something like a sexual dysfunction or hair loss, will see improvements in those things depending on kind of what the initial cause was. So, we see every day. Like one of my favorite patients was early on, I was treating men with erectile dysfunction with stem cells. And I was one of the first people that was, people have been using PRP for this procedure to inject the penis, but I was one of the first ones to start using stem cells. And I had this gentleman who had had a prostate surgery 4 years before, and he had had severe ED since then, and nothing worked for him. Viagra didn't work. They essentially wanted to put a prosthesis in him, but he came to me and he said, "Will you just try, like, just try stem cells and see if it works?" And so we did stem cell injections, and then I did some shockwave therapy sessions and increased his testosterone a little bit. And over the course of about 5 or 6 months, he regained sexual function. And one day he called me and said, my wife and I have started having sex again. again for the first time in 4 years. And, he's like, I didn't think this would ever happen again. And he said it wasn't perfect. He's like, there's still some room for improvement, but he was kind of blown away that this could happen again for him. So, stories like that make it worth it.
I'm assuming there was a lot of people also coming in with musculoskeletal issues and pain, back pain, and all kinds of issues in that area. Did you see significant improvements for those patients?
Yeah, I mean, Dr. Adelson would be the one doing those procedures, but
Right.
certainly, again, I think it's probably about 80% of people would have improvements. He's pretty selective about making sure that he's choosing candidates that are good candidates. Like if you need a surgery emergently, then you're not going to get stem cell therapy. But people who were supposed to be getting hip replaced or knees replaced were able to put the surgeries off for several years because their pain got so much better. People who had pretty debilitating back pain were able to do their favorite activities, skiing and hiking and things like that. So, not every story is a miracle by any means, but there are certainly enough of them that it made us believe in what we were doing.
And when it comes to skin and hair, which was your area, right? What type of outcomes would people see after having stem cells? And
With skin, it's kind of just general improvement in skin quality. So it's people saying like, oh my gosh, you look like you're really well rested and happy and you're glowing and like what did you do? Like it's not like you had a major procedure like you look puffy or that you had a facelift and you look, like tight or windblown. It's just kind of a subtle improvement in skin quality that goes improves over the course of like 3 to 6 months, which is why I like it. I like that you can, that it's not ever going to be it won't make you look crazy or, unnatural. And then hair, with hair, we see improvement in hair growth and hair quality in both men and women, yeah, even just after one treatment. But certainly if you're able to do more than one treatment, it can make a bigger difference. But, hair loss is really traumatic for people, especially for women. I think when you lose your hair, you're losing a big piece of kind of your identity sometimes. So being able to help with regaining hair with stem cells, and then we also use red light therapy and peptides, and a combination of things for hair loss. But it's very rewarding.
for women, is it that just you get more fuller hair where it's maybe thinning, or you're actually able to rejuvenate areas that are completely balding?
If you have, in general, with men and women, if you're completely bald and there's been no hair there for a long time, then probably we're not going to be able to regrow it because you have to have some hair follicles in the area to be able to activate them. But if you have kind of thinner hair in the area, then usually we're able to increase the density of hair, so number of hairs, but also the quality of each hair.
And is that PRP or is that stem cells that you injecting?
I use stem cells and then extracellular vesicles like exosomes.
Okay. And where does that come from?
We have a couple of different options. We can get them from the patient, so we can get bone marrow from the patient or fat from the patient, like a little mini liposuction, or we can also get them from like placental products that are donated after healthy deliveries. They just donate the placenta, and then the lab processes, and then we can get them back that way as well. So there's two different options depending on what the person wants to do.
And those are, I'm assuming, exponentially more effective than PRP.
They are more effective. Yeah, I mean, I think the PRP can be effective for sure, but you tend to need several PRP treatments to kind of equal the efficacy of one stem cell treatment. So I think they both have their place, and PRP is certainly less expensive. So I think it's a great way to start, if you are interested in trying some of these things. But ultimately, the stem cells and the extracellular vesicle treatments tend to be more effective.
You also got involved with Reputable Health in some capacity. I'm not sure if you're an advisor or if you have an active role, but the company does use variables and mini trials to generate insights for products. How did you get involved with them and what's your role with that company?
So I was actually one of the three founders initially with Kyle Berquist and Theben, and the three of us kind of put this idea together and got it started. And then I ended up stepping back into more of an advisory role just because I had so many other companies that I was working with day to day, but certainly still involved and excited about what's being built. But basically, Reputable is it allows companies like wellness companies and people who have products in the health space to do these clinical studies, these IRB approved clinical studies with people using like wearable data, home lab testing. Like essentially it's a novel way of setting up clinical studies to verify or vet products that are out in the world. So it's a different way to be able to say, does this supplement really work? If so, how is it improving sleep? How is it improving, lab tests? How is it improving various metrics? So it's allowing us to get more data on some of these wellness solutions out there to see what's really working and what's not.
And I know Reputable have an app and people can join and be part of these trials. Can you talk about a little bit of how sort of people, especially the biohackers that love to do their unequal experiments, how can they be part of like a sleep study where they're wearing their O-ring, maybe taking a supplement? What does that look like?
Yeah, the reputable community essentially where it's growing every day. It's people who are just interested in trying things out and tracking data and sharing that in a de-identified way with the reputable team. So, usually you'll have to have some kind of wearable or a ring or a Whoop or, ultra human, some kind of like wearable is usually required. And then sometimes it's other things too. Sometimes there's labs involved, like home labs or even going to other like going to LabCorp. But all of it is paid for you. And then you're trying whether it's a supplement or a device or a protocol, you're trying that, you're documenting your progress, how you're feeling along the way, but you're getting to try stuff for free, but with the condition that you're sharing your de-identified information along the way, and as well as your insights. So it's kind of a fun way to get to try new things, and you just get, if you go to the reputable site, you can join that community, and then you'll be informed when new studies are coming out, and if you qualify, then you can join it.
And the cool thing is that you actually find out if that product or supplement is actually working for you or not
Yeah.
and have some tangible data. So I think it's such a cool way to be involved, especially if somebody's already tracking their sleep with some device. What a cool way to say,
Yeah.
is this supplement actually working for me? Because it's so bio individual. So you
Yeah.
can really learn if something is working or not.
Yeah, and we have we of course are AI integrated and have been for the whole time, and so we have the AI that we built out is really good at giving insight. So it's much better than you saying, I think I'm sleeping better with this. It's really digging into the details and giving you specific details about all the different metrics, your HRV, your sleep, your movement, all the things.
And then you also founded the Human Optimization Project. What problem were you trying to solve for women specifically?
So Hop is a female longevity product. It's a supplement product that is just essentially it's a daily pack, a twice daily pack. And it's funny, I never meant to be in the supplement business. Like I never had aspirations of being in this business. But several years ago, probably 3 or 4 years ago now, I was dealing with all of these supplements that I was taking, and I was also trying to help my patients. And I was always, writing down lists of things I wanted to take, and it was all these bottles on counters, and me having to order things every month, and I would always forget. And so I just like there has to be a simpler way to get the things that I want to take into like just a daily pack. And so it kind of started from that, and realizing that women specifically didn't have a lot of their own products, the longevity space, if you will. And this is again 3 or 4 years ago, so this is kind of just early days, but was mostly is directed at men and male products. But I wanted to have something that is directed at women, and it provides education for women and really speaks to women about what they're going through as they get older, kind of midlife women. So like myself, essentially I created the product for people like me that wanted something easy, and so we're still making it, and it's super fun. I have a great team there that I love working with.
So how are these supplements catered to the female physiology specifically? Like what makes them different from a regular supplement?
I mean, I will say that certainly males and females can take them. We do have about 20% of our users are men that have gotten the products from their wives or for friends, and they love them. But there are several ingredients that are just specifically great for women. Like for instance, dihydroberberine, which is really good for blood sugar and lipids and inflammation. We know that midlife women, as you kind of go through perimenopause and intermenopause, we see big increases in insulin resistance, and we see big increases in a worsening of lipids. So you want to, so dihydroberberine is specifically attacking that problem that happens to midlife women because of loss of estrogen. Similarly, things like astaxanthin. Astaxanthin is a very strong antioxidant, and it has a lot of skin benefits. It has a lot of antioxidant benefits. And, women oftentimes are worried about skin damage and improving skin health. So there's a lot of ingredients like that. Certainly they work for men as well, but we're thinking more about like what's happening with female physiology, especially in midlife, and how can we combat some of those changes.
And is this a multivitamin type of supplement, or do you have different supplements for different things?
We
How do
just have one product currently, and it's not we don't consider it a multivitamin. We want you to get most of your micronutrients from food. So the things that we've chosen to put in here are ingredients that you don't tend to be able to get enough of in food, or they aren't even available in food. Like for instance, spermidine. We have spermidine in Hot Box, and that's, as you know, it is available in food in very small doses, but there's a lot of research now coming out with discussing spermidine for autophagy and for longevity and for skin and hair and for, it's kind of a fasting mimetic. So we wanted to have higher doses of that than you can get in food, in compliance kind of with what the studies are showing. So we do have some vitamins in there, like we have some B vitamins and vitamin D, but for the most part, the ingredients are not things that you're going to get a lot of in food.
So this is more specifically like a longevity supplement for
Yeah,
women in midlife.
exactly.
Okay.
Exactly.
If you are somebody super proactive with their health, this is something you can take in addition to maybe some of your other supplements and obviously good nutrition and all the good lifestyle changes too.
Yeah, exactly. It's kind of like your longevity pack in a, like longevity stack in a pack. Like it's essentially putting together all the things that we think have the best evidence right now that are safe, but putting them in the doses that you'd want to take them and putting them all in one pack. That's much more economical and also much easier than having to do all the bottles yourself.
And you just take one a day, or is it like a whole bunch of
It's
supplements you
two
take
packs a
together?
day. Like the packs look like this, and
Okay.
the box looks like this up here. I'm like, if you can see that, but two packs
Yes.
a day is most some people just take one, but like two is the dose that we formulated initially.
You also got involved specifically with women's health. I'm assuming it has to do with your own journey of going into midlife to some extent. And you talk about the queen phase. How did you get involved with this?
So I call the queen phase is this is my term for perimenopause, menopause. And I think of it like this. I think of like estrogen, we know estrogen is really important for protecting all different parts of our body, from our brain to our heart, our bones. We have estrogen our entire life and it's protective. It's like silently there protecting you. And then during perimenopause, which can be 5 or 10 years before menopause, estrogen kind of starts to fall away. And then in menopause, your shield has really dissolved and you're left really unprotected. And so for me, this idea of queen phase is you are now without protection. Like you've kind of left your princess phase where like something invisible was protecting you. And now you've moved to a phase where you have to protect yourself, whether that's with a healthy lifestyle and really being very proactive with exercise and diet and sleep and stress, whether that's adding in hormone therapy, which I am a fan of. But it's a time for women to stand up and take ownership of their health in a way that they may not have before.
We can get away with a lot of things even in our 30s, and then you start hitting your 40s and 50s,
Yep.
and all of a sudden you realize, okay, I have to get everything dialed in to function
Exactly,
properly.
exactly. Yeah, you have to
Yeah.
you got to either bring in some other soldiers or like become the soldier yourself, but you've got to do something because it's not like you don't have that invisible protection anymore.
There is a difference between men and women of when this happens because women, we really start hitting that in our 40s pretty hard. And then once we get into our 50s, they are pretty dramatic changes. I think for men, it's almost like delayed by 10 years or so when they start going through the same issues. Obviously, their issues are going to be different. What do you see? Do you primarily work with females or do you work with both men and women right now?
I actually work with both men and women, but the main difference I see, with men, it's primarily testosterone we're looking at, and testosterone starts to go down at age 25 or 30 for both men and women, and it just kind of slowly declines with age. Like it just kind of slowly marches down. So certainly men in their 40s can have low testosterone, many do, but it's a slow, gradual going down. But with women, the issue is that estrogen and progesterone, they essentially are going, 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 and then they just kind of fall off a cliff. And there's a big drop, and there's nothing that you can do about it. For estrogen and progesterone, no amount of perfect lifestyle, heavy lifting, sun exposure, perfect relationships, stress, sleep, like none of that, it'll help certainly, but it's not going to prevent those hormones from falling down, which is different than with men. With testosterone, a healthy lifestyle can make a huge difference in keeping testosterone levels up. And so oftentimes, we're definitely going to start with lifestyle in men and women, of course, as well. But lifestyle alone can get testosterone up in men, whereas lifestyle alone will not get estrogen and progesterone up in women.
We are so much more sensitive to stress, especially as we get into our 40s and 50s. And I think that is everything that comes together. Raising children, you could be the top of your career at the same time, maybe even taking care of your own parents that are now elderly. So the stress just kind of piles up in midlife. And then at the same time, we start losing our hormones.
Yeah, I
And
know.
that comes together. It can be very challenging for a lot of women.
It can. And I think that one of the hardest things is that until really the last few years, women didn't really talk about all of this. And that, I think there's a big lack of education about perimenopause and menopause and what that means and what these hormonal changes are like. This is nothing to scoff at. Like this, about 10% of women during perimenopause become suicidal, and depression increases by 30 to 40% during perimenopause. People feel very anxious, relationships break up, marriages split. This is a very tumultuous time, and it's certainly not all the hormones, but the hormones do play a big role. And so understanding what's coming and understanding kind of some options for dealing with it can make a huge difference.
So what I'm hearing is that probably one of the foundational things that you consider really important for longevity is hormonal optimization in midlife.
Yes, I think that estrogen for women is kind of like the forgotten longevity drug. If it was invented now and came to market now, it would be a multi-billion dollar drug because of all the good things it does in terms of preventing osteoporosis and heart disease and dementia and urine infections and just everything. But because it came along a long time ago, and because of some of the misunderstandings about it that came out in the early 2000s, women just don't know about it, and even doctors are still scared of it.
You also got involved with Humanát Health, and you're one of the founders, right?
Yes.
And so tell us about, from what I understand, it's a longevity clinic and it's a franchise. What does it actually look like to like walk into one of these clinics and go through the longevity journey from like day one?
Yeah, so I'm the one of the co-founders and I'm the chief medical officer of Humanát Health. And it's like Humanát like astronaut, like but with humans. And we started in Austin. We have our first clinic in Austin opened last year, and we just now opened in Florida, and then we've got Dallas coming up in a few months. But basically, we tried to put under one roof kind of all the different things that we wanted to see for ourselves and our friends and family members. So for instance, we do advanced diagnostics. So we do, of course, normal blood tests plus all additional blood tests and advanced testing if you want it, like microbiome and gut testing. And we do DEXA scans to look at your bone mass, and we do VO2 max tests to look at your functional aerobic capacity. So we're doing a bunch of different functional tests to see kind of how strong you are, how your balance is, how strong your bones are. You're looking at your blood vessels and seeing if you have plaque in your vessels. We do a bunch of diagnostics and then come up with a plan to try to help you. And then we have a couple of different membership tiers that you can work with our physicians or our nurse practitioners or our PAs on an ongoing basis. And so, of course, we offer things like hormone replacement, we offer peptides, but we also offer specific medications that maybe are used in novel ways. We have, of course, supplements. And then we do a lot of lifestyle medicine as well with coaching and trying to help you, develop healthy habits. And then we also have under the same roof, we have a gym and we also have a regenerative medicine suite. So we can do stem cell procedures, just like we do here in Park City. We can do those now under that same roof. So it's kind of like you're all in one place for longevity.
Would you walk us through what you think are the essential components of modern longevity programs? So when you think of putting together the most amazing longevity care, what are the main pillars and components of that?
I think one of the main pillars is certainly help with lifestyle, whether that's coaching or some sort of other very specific personalized lifestyle program, because we know, of course, that lifestyle is the most important thing that any of us can do, and that it's the foundation. And if you're not doing that, the exercise, the sleep, stress moderation, diet, then nothing else is really going to move the needle that much. So that's foundational. And I think it's probably the hardest piece, honestly, of any longevity practice is figuring out how to help people make changes to behavior, because we're all a little bit stubborn and we're all a little bit lazy, and we don't necessarily want to change what we're doing. So I think that's the hardest thing. And then on top of that, I think, the foundational stuff is also good screening tests, good diagnostics that are looking forward, 5 or 10 years and trying to prevent diseases before we actually develop them. So being very evidence-based and looking at, what are the precursors to diabetes? Maybe you don't have diabetes yet, but you have a blood sugar, it's a little bit too high. How can we reverse that so you don't ever even get close to developing diabetes? And so just taking a very proactive stance on disease prevention, for especially for things like heart disease and dementia and cancer, some of the big ones there. That's important. And then I think also having some of these novel therapies is fun. I don't think that it's as important, but things like peptides, things like, plasmapheresis or EBO2 or some of these kind of newer fun treatments. I think those are other bonuses, and we have those things, but I think you really have to start first with the lifestyle diagnostics and then, add on to that the fancier things.
There are a lot of players entering this space. There are some existing ones and new ones, like Fountain Life, been around for a few years, Next Health. And then there's like the biohacking franchises like Upgrade Labs, Restore Hyper Wellness. And there's so many niche sort of modalities emerging. How do you compare Humanet's model to other players in the space? And if I were a patient compared to different longevity clinics, what would I notice that I feel distinct about Humanet's model?
So Jim Donnelly, who is the co-founder and he's the CEO of Humanát, he was actually the co-founder of Restore Hyper Wellness. So
Okay.
he founded Restore and then grew that to, 250 plus locations across the country, doing red light therapy and cold therapy and all those kind of things, kind of like wellness, hyper wellness, but not so much hard medicine. But then, his idea and the reason that he and I met, where he wanted to really create kind of what's next after you have the wellness pieces. Like, we want to do like kind of real medicine with real doctors with real kind of life-changing protocols. And so that's where Humanot came into play. I think some of the differences are, we do have in-person clinics as well. In person, we'll do both a combination of in-person and telehealth. So we want you to come in, we want to see you, we want to do in-person diagnostics, like, really get a good look at you. We want to do a full exam. We want to make sure that we are assessing more than just the things we can get on blood tests. And I think that's really important. And certainly we also offer telehealth, but we want to have a combination of those two. And then we also have the programs, the clinical kind of protocols that have been developed by myself and a couple of other people are really, we have a big, strong hormone focus because I really enjoy hormones. I think they're really important. So the way that our approach to hormones is, I think, a little more forward thinking maybe than some of the other people out there, and proactive. And we also have done a really good job of, bringing in technology. We're a tech savvy company and trying to make use of all the tools that are out there in combination with our educated providers to really provide an exceptional experience.
One of the things you mentioned is that your hormone therapy is more forward looking. How is it different from sort of the traditional functional medicine approach? Although there are so many versions and variations of how practitioners
Yeah.
are doing hormone replacement therapy, but how is yours different?
And I think I shouldn't say it's better than anyone else's. I don't know how they're doing it because everyone's a little bit different. I've spent the last 12 years, in this kind of hormone space and really spent a lot of time in it. And I've done multiple different trainings. I've gone through traditional, allopathic medicine trainings. I've gone through functional medicine, A4M, kind of anti-aging medicine trainings. I've gone through, like Neil Rousier, so there's all these different, I've done all these different training programs, and over the years have kind of put together what I think are the best, most evidence-based pieces of all of those programs. And then I from that developed our clinical protocols for Humanot. So I just think that unfortunately, it takes a long time to really understand this stuff, and it just, many providers just don't have the depth of knowledge, the years of knowledge spent in this space. And certainly, I think I love that everyone's getting into this and everyone's starting to do hormones, but there's a lot of nuances that take some time to understand.
This is a franchise model with multiple clinics. I'm assuming you're not the medical director for all of them, because you have to be licensed in each state.
Yeah.
How are you duplicating that knowledge, that deep knowledge in hormone therapy that or are you training the other providers in those clinics?
Yeah, that's the most difficult piece, I think, certainly, is how do we transfer what's in my mind or what are the other physicians in our group's mind into, new people that are coming in. And we have a combination, we're doing it in a combination of ways. We're creating a video library, like I'm creating a hormone course right now as we speak that really goes into all the methods and the madness there. And then we also have in-person and telehealth didactic sessions where we talk to the new providers and go through cases and, how would you approach this? And then once they get started seeing patients, then myself or one of the other medical directors that we have will go through the cases with them and make sure that they're doing things the way we would do it, give suggestions, kind of hold their hand for those first several months, and then kind of continue to periodically check in. I'm the chief medical officer, so I'm not the medical director, but I am in charge of the training. So I do a lot of the trainings, and then we also have medical directors who are directly responsible, kind of oversight as they go forward seeing patients.
The other piece you mentioned was technology, being very technology forward, which obviously very important nowadays. What does that mean? Is it the diagnostics that you use to MRIs or some other type of technology to look into the body and find things early and detect things early? Is it lab testing or is it applying some sort of a AI to digest all that data and discern certain therapies or longevity strategies that you can apply?
Yeah.
What do you mean by technology?
It's both. So we're certainly always looking for the, newest, best tests. If there are tests for whatever it is, cardiovascular prevention, risk factors for, MRIs or teardrop tests for breast cancer. There's always new tests coming out. And so we're always vetting the tests and looking for the ones that will be the most beneficial for patients. And we're pretty quick at going through that process and bringing new things in when we think that they're a good option. And then on the other side of it, we're also really leaning into AI, and we have since the very beginning, essentially training our AI to take all of the protocols that myself and my team have created and that are very specific, with doses and supplements and medications and first tier and second tier and third tier, and then using that to train the AI so that when new providers, enter in kind of some general information about patient and labs and diagnostics and put them together, the AI can help by putting out a kind of a care plan. And then, of course, the physician or NP will then review the care plan, make changes, talk about it with us, and then use it from there. But it's a way to aggregate all the information about patients into one place and use that to then help make some of these care plans that are very specific for patients.
This is where the advancements really need to take place. It's so urgent that this
Yeah.
happens because we are collecting more and more data from variables, from all these lab tests, from all the diagnostic tools that you have in your clinic. But for one person, that one doctor to put it all together, it becomes almost impossible for that doctor to digest all that
Yeah.
information on their own because like you literally have to sit for hours and just like learn about the patient background, health history, look at all their charting information, all the pieces of labs, all the like the doctor would have to spend hours and hours just
Yeah.
kind of learning and then putting together a protocol. And I'm assuming that's not even sustainable for
Right.
the type of a clinic to put in that much time. But that is what I think patients are expecting now, that you're going to connect all the dots.
Yeah.
And really, I think, is the only solution. But that we know training AI models is very expensive.
Yes.
So you guys started now, you're training your own AI model is what I'm hearing.
Yes.
And how is that progressing? What do you see the trajectory? How quickly is that going to be developed?
So we're already using the care plans. I mean, in the beginning, we trained the AI immediately before we even started seeing patients. And the training is it's a continuous process. We're always teaching it to do new, and it's also teaching us things. Of course, it's creating insights from data that we didn't know were there. But it's getting better and better at creating care plans. In the beginning, the care plans were pretty good, but we had to spend quite a bit of time after that going over them and being like, I'd probably give this supplement, not this one. I would probably change the exercise to this, not this. And so like there were small adjustments along the way that were always having to be made. But the cool thing about it is you can make those adjustments and then you can essentially use that to teach the AI a better way of doing it, or the way that you want to think about it. And so it just continues to get better and better. And I think you're right. I mean, we have all of this data now on patients, from genetic data and epigenetics and, proteomics and all these metabolomics that we talk about, plus the wearables and plus everything else. And so how does one person take all of that information and create anything out of it? And I think that it's possible. And, doctors have been doing this for years, but we have so much more information now than we used to. And so I think we do have to rely on technology to help us with figuring out what it all means.
Why did you and your co-founders choose the franchise model, and how do you see that impacting access to longevity care? Because I'm assuming you're trying to reinvent healthcare or preventative care in some way. What is the vision for the future?
So we chose the franchise model for a couple of reasons. One, because Jim Donnelly had done it before successfully with Restore, and he and his team really did a great job getting those clinics out and making them, really available to people all over the country, within just a couple of years. And so our vision is to make this health optimization, longevity medicine accessible to people all over the country quickly. And to do that, we wanted to lean into franchise where we're able to, really roll out much faster than if we were building corporate clinics one by one across the country. And because, our goal really is to make this something that it's changing how we're approaching medicine and self-care. Like certainly you'll still have your kind of sick care model. You'll still have the hospital, and we appreciate that. You'll still have the emergency department, but we want to be the people that you come to stay healthy. That if you want to be proactive, if you don't want to end up in the hospital, you're coming to see us, and we want to make it, affordable and something that people have access to all over the country.
And is the franchise now available in all the states, or is it just still limited to certain states in the country?
So right now it's just limited to the states where we have clinics, Austin and Florida, or Texas and Florida. And then Utah is coming soon as well, pretty soon. We are working on going nationwide. We just got to get a lot of people credentialed in, all the states. It takes a little while to get all the medical team credentialed, but as we're rolling out new clinics, we'll certainly be just opening up new locations.
Is the ownership have to be a doctor or some licensed person, or it doesn't matter?
Not usually. There are different rules depending on different state. Some states are stricter than others, but usually the owner doesn't have to be a medical person. Certainly, you do have to have a medical director for every clinic. You have to have medical staff who works there and all that. But usually the owners can be, in many states at least, they can be more of like a business person or someone who's owned, franchises before.
And so what are the next clinics? You mentioned 3 locations. Can you repeat where you have locations already and then where you guys are expanding next?
So we're in Austin, Texas, and we're in Palm Beach Garden, Florida, and then we're going to be going to Dallas next. I think we're building out that clinic now, and then probably Utah will be next. We're looking at space in Utah, and then we have some other ones that are pretty soon. We think probably early 2026 that we haven't signed them yet, but we're getting pretty close up in the Northeast.
Congratulations. I'm so excited for you. This is really so incredibly exciting. It seems like you're really pulling together all the best pieces of regenerative, longevity, functional medicine, everything under one roof. And the key is to really make it affordable for people, and not just the ultra rich that would
Yeah.
have access to this. What do you see the cost being? Because it's all out of pocket, so people have to be able to afford to pay for this. And I'm assuming people still have their own allopathic team through their
Yeah.
insurance. This is an extra layer on top of that, right?
Yeah. Yeah, we have a few different membership tiers. So we have tiers really that are going to be catering to various people. So we do have a higher end, membership tier. If you are interested in that kind of concierge longevity medicine, then that's certainly available. But we also have membership tiers that are more like, $200 a month ish, where you're still getting, more extensive labs. You're still getting quarterly labs, quarterly visits with our care team. You're getting access to the clinic and all the things that we're doing, but at a much more reasonable price. And and certainly we're going to continue to try to push that number down even lower as we have more clinics in the space.
You mentioned you have a gym too, right? And what does that look like? Is that something similar to what hyper wellness have, or is it more like a traditional fitness facility?
So we have a gym where we do all of our, our testing, and then like a bit, we have testing for VO2 max. We have a bike and a treadmill and a stair climber, and we also have a weights machine that does all the different types of weights. We have what's called VALD, which is looking at balance and power. So we use it for assessments for new patients, but then we also have an exercise physiologist that is there on staff that helps people with workouts and creates workouts or can do training sessions with people. So some people certainly have their own gym and they want to go to their their Gold's Gym or their Lifetime Fitness, and that's great. We want to just have a space for people if they want more training, and then of course to do those assessments on patients.
What advice would you give to other clinicians that want to step into the entrepreneurial role in this fast-growing space without losing their scientific integrity?
I think it's as doctors, or maybe this is just me, but I feel like doctors are often kind of put in like a box. Like we're told you can only do this one thing. If you're a radiologist, you will only ever be a radiologist. If you are a surgeon, you will only ever be a surgeon. Because you spend a decade refining those skills. And so you kind of think of yourself as, well, I'm a radiologist, I'll be good at it, but I can't do anything else. And I think what I would tell doctors is that you are smart people and you don't have to be the thing that you started out being. Like you can change. If you want to change, you are capable of learning even after residency is over. And there's so much more out there in terms of business opportunities, in terms of, kind of specialties within specialties and even non-medical opportunities that are available, and that we don't have to put ourselves in boxes if we don't want to.
Looking ahead 5 to 10 years, which is very difficult to do with AI coming online. I feel like we can't even look more than a couple of
I
years
know.
into the future. But assuming we are looking ahead, how do you think regenerative and longevity medicine will look like? What roles will women play in shaping that future?
I really hope that these things become woven into the traditional healthcare landscape. I hope that, that having your longevity doctor and having your traditional primary care doctor, like it's just something that everyone has. Or that the traditional doctors are doing more longevity medicine and you don't have to even have two different doctors, that everyone, whether you're a surgeon or a dermatologist or a plastic surgeon, you're adopting some of these things that we're doing in longevity medicine as part of your practice. And so you don't have to necessarily even have two doctors. I think that stem cells and regenerative medicine will just continue to be bigger and bigger, and it will make it hopefully less expensive as we go forward and more options for more people, because it still can be expensive to get some of these therapies.
I want to know how you're balancing this all because you are a mom, you're a practicing doctor still doing procedures, you are involved with all these companies as an entrepreneur. How are you juggling all this?
Sometimes not very well. I work a lot of weekends and I work a lot of long hours, but I really love, like I get so excited about what I'm doing, and I love researching, and I love writing, and I love, I love creating. And so even when I'm working long hours, I feel like it's something I love doing. But I also, I do spend time with my family and go on hikes and vacations, and I get to travel for work. So I feel like I'm able to do all the things, but I sometimes I wonder if I'm doing any of them as well as I could.
We all struggle with this, especially that I'm sure you're catering to a lot of high performing women or women that want to perform at a higher level. And those are probably also your clients and the
Yeah.
people that come to your clinic. And you are certainly modeling that lifestyle, or they're setting a very high bar for people who are women.
Thank you. I'm trying anyway.
I would love it if you shared all about your companies. If people are interested, where do they go? You said two clinics are already up and running, so I'm assuming they can make an appointment and show up. Tell us about
Yeah.
that first.
So Humanat, I'd go to the website, so humanathealth.com, and it's Humanaut, Humanat. So website's great. You can find the clinics there and you can come see us there. Hopbox, my supplement company, is hopbox.life, and that is a single place to get that product. And then Reputable, which you talked about as well, is reputable.health, and that is the one that if you're interested in being involved in studies and trying out new products, that one's that. And then my website is dramykillen.com, and I have links to all those other companies on my website. So if it's easier to go to my website, you can do that. And also I'm on social media, Dr. Amy B. Killen, and I do a lot of educational posts and try to have fun on that as well.
Yeah, and you're still involved with those there clinics as well, right?
Oh
So
yes.
if
Oh yeah. Sorry, I
somebody,
forgot that one.
yep.
Docere Clinics is DOCERE clinics.com. And that's where we do the stem cell procedures here in Park City, Utah.
I recommend just going to Dr. Amy's website and looking at all
Yeah.
this because she has a lot of companies, a lot of
Yes.
things she's involved with. Amazing. Well, is there anything else that I didn't ask you about? Anything you'd like to share that you would consider important to share with our audience?
I think that we've covered most things. I just feel super grateful that I get to be. I think that the longevity space, especially the women's longevity space, is something that is going to continue to explode, and we're going to see more and more coming out. And I'm so grateful that I get to be a part of this kind of revolution.
Dr. Amy Killen, thank you so much for your time today.
Thank you so much for tuning in. This is Maya. Our production team pours our hearts into this show because we believe women deserve better. Better conversations, better tools and health strategies that are actually built for our physiology. But here's the truth. This show doesn't grow on its own. It grows because you share it. So if this episode hit home, do me a favor, follow the show, leave a quick review, and text it to a girlfriend who needs to hear this. And if you want to go deeper or connect with other women on this path, come join our free community at optimizedwomen.com. Thank you for being here. We appreciate you more than you know. The views expressed on this podcast are solely those of the speakers and do not reflect the host's opinions. The content is for informational purposes only and is not a substitute for medical or nutritional advice. Always consult a licensed healthcare provider.